Hey guys, so this is just going to be a real quick video about phlebotomy if you're in nursing school, or I guess if you're in any kind of schooling where there's phlebotomy being used. I'm in nursing school myself, so this is a skill that is introduced but not necessarily perfected in the program. This is something that you're probably going to learn as you get out and work as a nurse, unless you do like a nursing externship or internship or some kind of care partner type of job prior to graduating. So don't mind the shirt. It's got a couple holes in it, but that's not what we're paying attention to. So what you'll need is a butterfly needle, which is, it comes in different gauges. This is a 23 gauge. You can do, and here in the back you can see if it's what gauge it is. Of course, the smaller the gauge, the bigger the needle. So there's generally, for butterflies, there's 23, which is a bigger needle, and then a 25, which is a smaller one. 23 is the one most people like to use. 25 can sometimes get clogged easier, and it's often used for smaller veins. So, normally you will probably use a 23, but if you go in the hand, 25s can work pretty well. So here we go. So we're gonna open this up. So this is what you have. You have a needle. This is why it's called a butterfly, because it has these flaps. And then you have this extension. Now be real careful with this extension, because here there's a needle under this. So if you hit it or pierce it in any kind of way, you're going to hurt yourself. So there is a needle here. So when you're done with this in a hospital setting or in a clinic setting, you want to put this in the sharps, not just this part, but this part as well. It all comes in one, so you'd be throwing the entire thing. But just keep in mind that this end also has a needle. Now you also have this thing right here, and it will go on the end of this needle. Everything screws on, so it's real easy. So all you do is just screw this on, and then that's it. So, and the reason that this is here is because when you take a vial, such as this, and you'll pierce this needle, the vacuum inside this vial will suction the blood from this end of the needle out of your vein into the vial. That's why there's a needle at the end of this. So here we go. So you're going to get some vials out. This is just for showing you how to do it, so we don't need a ton. But depending on what your patient has, what kind of lab work they have, will be color coded. I'm colorblind, so for me, it's a little bit difficult. But since there's not that many different colors, you can manage if you are colorblind. I know that some men are colorblind, so you've got that concern sometimes, but it's not a big deal if you are. It'll work itself out. So I'm gonna take this right here. You don't need this if you're doing it on a patient. I'm just doing it using the tape on myself because to keep it stabilized. So basically, this is going to be a little bit interesting because I'm doing it on myself, but you want to put this elastic band prior to looking at veins. Some people look at veins before, but I like to put this elastic band prior. So again, this is going to be a little bit different because I'm doing it on myself, but let me see here. So now, for the patients, I will also mention this. It's helpful to put it across the shirt or the gown, because it doesn't hurt as bad. If you put it on the skin, it does tend to hurt. So let's see if we can do it. Tie the band in such a way where you tuck one end under. That way it's easy for you to pull it when you're ready to release. In my case, I couldn't really do that because, well, there it goes. So let's see, maybe I can. Let me try to do it in such a way where okay, so I was able to do it. So here we go. So that's how you tie it off with one. Hopefully you're not using teeth when you do it, but so that will, and sometimes you can have a patient pump their fist or do some other things, but you can see on mine, the veins are pretty good. There's an AC right here, antecubital vein right here. It's pretty easy vein to get on me and on most patients. It's not my favorite vein, but some people really like it. So now the way you grab this needle is you grab it, if the flaps are at the bottom, you'll grab the flaps this way. The reason you do that is because the needle will be up, the bevel will be up, which is what you want. You want the bevel up. That's the proper technique. There are other techniques with bevels down, but that's something that's like more advanced with particular patients. If I'm not mistaken, I think it's pediatric patients is sometimes they do bevel down. But so you'll take, again, as I was talking about before the video cut out, the proper technique is bevel up. But before you do anything, you want to make sure you take an alcohol swab, give it a good swirl. Some people don't take that long, but if you really want true antiseptic techniques, you have to give it, a good amount of ability to, and time to work. So that's what I was trying to get at. So then you take bevel up and you go in. And what you'll notice is you will notice a little flash. You can see it right there. A little flash in the tubing, and there you know that you've hit a vein. So when you see that flash, you're good to go. So then what you do is you'll put this tubing in. A lot of times people will have this prepared, and then puncture the vacuum tube, and then the blood starts to collect. Like I said, in my case, I can put like this little tape on to secure it. And then we're good to go. So it's filling up. Now the vacuum tube will stop on its own. So once it stops, unless you don't need the full tube, and then you can stop it. But once it stops, then you can pull it out. And then you have your vial of blood collection.